Hi guys, so today I would want to discuss about leprosy and treatment and summarize the whole topic. So, what is the causative agent? Its causative agent is Mycobacterium leprae, and it is a gram-positive and aerobic rod-shaped bacillus. So, it actually causes a glomerular disease, which affects the peripheral nerves and uh, and mucosa of the upper respiratory tract. It also affects your reticuloendothelial system, eyes, bones, and testes. Now, what are the signs and symptoms of this disease? In early symptoms, you will find loss of temperature, sense, and numbness, and then you will gradually the, the other deeper senses are lost. So, first of all, the upper senses there are loss of temperature, the sense of temperature and numbness will occur, and then gradually your proper touch sense and pain they will be decreased or even lost. When there are late symptoms, the late symptoms are you have a paleness ulcer. Sometimes there is pain, but most of the question like there is a painful ulcer and hyperpigmented macules, which are pale areas of the skin, and you will also have eye damage because of dryness of the uh, your dryness of eye and loss of blinking reflex. Now the thing is that the other now when this progress more, it will develop into the ulceration that were painless become large, and there will be even loss of digits and facial disfigurement. Now there are two types of your leprosy, and this one is paucibacillary and second is multibacillary. In paucibacillary, there are 1 to 5 skin lesions. In multi, there are 6 to more lesions. And in pauci, there are none or one nerve involved. But in multi, more than one nerve is involved. And in paucibacillary, you will not diagnose it by skin smear, and its skin smear will be negative, and it is seen in two types of the leprosy, that is tubercular leprosy and borderline tubercular leprosy. In multibacillary has you will find the skin smear to be positive, and lepromatous borderline and borderline lepromatous types come into this. Now, how to diagnose this? So the main diagnosis text can be clinically by judging the signs and symptoms, and the other diagnosis systems are slit skin smear and skin biopsy. Now, moving forward, what are the drugs that you are used to treat leprosy? So, you can remember like this. Remember by CARD. Okay. So, multi-drug therapy of CARD is used. That is clofazimine, rifampicin, and dapsone. And when you give this therapy for like 3 months continuous, the patient become non-infectious, but it cannot spread the leprosy. In some cases, instead of rifampicin, ofloxacin is also given, and dapsone and clofazimine is usually not given in pregnancy. So let's talk about the detail of these drugs. So first of all, dapsone is a sulfone, and it is the oldest drug, and it is the drug that is it is found resistance. This drug is sometimes there is a resistance of this drug, which is can be solved by giving the multi drug therapy. Now, it actually inhibits PEBA conversion to your folic acid, and actually it has a half life of 24 hours, and its adverse effect cause your sulfone syndrome, leprosy reaction, and peripheral neuropathy. Now the other drug, second drug is rifampicin, and it is 99% cidal mean kill your Mycobacterium tuberculosis bacteria, and in within 3 to 7 days. And it's the monthly dose is around 600 milligram, and in some cases fluoxetine is given instead of rifampicin. Now moving forward, cefoxitamine, it actually alters the membrane structure and transport of the bacteria, and also interfere with the template DNA, and it is a half life of 70 hours. Now there are serious adverse effects of this drug. You will have reddish black discoloration of skin, even of the body fluids, which are not mentioned here, but it also causes the reddish black discoloration of of your other body fluids. It also causes dryness of skin, itching, leprosy reaction, and you should not use if your liver, if the patient is liver is suffering from liver and renal disease. Also, he is pregnant. It also causes conjunctival pigmentation. So, to summarize, we have leprosy causative agent, that is Mycobacterium leprae, that is gram-positive aerobic rot-cell bacillus. It's a granulomatous disease that affects the peripheral nerves, mucosa of upper respiratory tract, and other signs and symptoms. Early signs and symptoms, there is loss of temperature and other senses, and later symptoms you will find ulcers and hyperpigmentation and disfigurement. Types are posse and multibacillary, and the drugs used to treat are card, chlorhexazine, rifampicin, dapsone, and sometimes your ofloxacin. And thanks for watching.